So the topic I was giving to talk about is benefit of partial hydrolyzed protein formula from the nutritional perspective and its impact towards the health of children. This is the layout of my presentation, and it goes, of course, beyond anything that breastfeeding is the best way to feed all infants, and that breastfeeding is an unequaled way of providing the ideal food for the healthy growth and development of infants. But as already said, not every infant can be breastfed, and therefore we need also other options for infant feeding. But what do we know about the preventive effect of breastfeeding for allergic disease compared to formula with intact protein? Well, this is from a paper from the whole series of papers published in the Lancet some 4 or 5 years ago, which concluded that there was no association found that breastfeeding would protect for allergic disorders such as asthma. And according to the American Academy of Pediatrics, who published a paper just a little bit more than 1 year ago on preventive effects and looking at breastfeeding and the prevention of food allergy, they concluded also that no conclusions can be made about the role of breastfeeding in either preventing or delaying the onset of specific food allergies. So if today there is a lot of discussion if partial hydrolysates do really prevent allergic disease, it's the same discussion is going on for mother's milk. It's not clear that mother's milk is really decreasing allergic disease, but it's not because breastfeeding does not decrease allergic disease that it is absolutely not the best way to feed infants. It's absolutely the recommended way to feed all infants. And this is another paper looking at breastfeeding. Does it prevent allergy? And what it shows you is that at the beginning, yes, there seems some preventive effect of mother's milk compared to infant formula to prevent allergic disease. But as the child gets older, over 7 years old, that preventive effect disappears because allergic disease is, of course, multifactorial. And feeding is just one of the, I just imagine 35 different ways, so 35 factors which influence the outcome of allergic disease. So on breastfeeding is the best way to feed all infants, but there is no evidence that on the long term, breastfeeding does prevent allergic disease. On the other side, the earlier that we do intervention, the bigger the impact will be, of course. And as already highlighted in the previous presentation also, early intervention has also the advantage to have an influence on the development of the gastrointestinal microbiota, which indirectly will have an influence on the development of the immune system, which may then have a relatively prolonged positive effect. But so that's for the prevention part. But what about nutritional aspects? Well, we did quite some time ago, because as you can see, these studies are almost 30 years old. Different nutritional studies in our unit in infants fed different hydrolysate and measured a lot of nutritional parameters. And what it did show is that birth weight up to the age of 3-4 months, 30 weeks here, that weight gain was exactly the same, whether you compared breastfed, intact protein, extensively hydrolyzed protein, or 2 different partial hydrolysates. You see that the total weight gain over that 13 weeks, or the weight gain per day, was in fact exactly the same for the 5 different groups. And these are more data from these studies, which showed also that, in fact, the intake of volume and calories with the whey hydrolyzed was relatively smaller, which is, in fact, for our part of the world, a good advantage because of the high incidence of obesity, and that's related with the excessive caloric intake, but that resulted in a similar weight gain, so a better use of the ingested calories. And there was no difference in duration of feeding, number of pauses, number of stools, number of regurgitations, and no difference in any of the other nutritional parameters measured. So it suggests that, in fact, partial hydrolysate is better metabolized, better used by the system of the infant than intact protein. Hanyasejewska looked also at extensive and partial protein hydrolysates for preterm formulas, and they concluded the same, that the study suggested that experimental extensive hydrolyzed and partially hydrolyzed formula are at least nutritionally equivalent to standard formula for preterm babies. Another study coming from Germany, you will maybe hear more about it in the next presentation, but looking at the nutritional value of intact protein versus a partial hydrolysate, looking again at weight gain, length gain, head circumference, shows you very clearly that there is no difference at all for both boys and girls in evolution of nutritional parameters with partial hydrolysate. And this looks more at bone mineral content and bone density, but again shows you that there is no difference at all. So suggesting equal nutritional value between intact protein and partial hydrolysate formula. This comes from the gene study. Then looking at the evolution in weight in the children which were fed different formulas up to the age of 60 months, so that's 5 years old, with partial hydrolysate formula, extensively hydrolyzed formula, intact cow's milk protein, and the reference breastfed group. And you see that at the age of 5 years, no difference at all between the different groups, again showing a good weight gain with partial hydrolysate even after the period that the partial hydrolysate was fed. Another way to look at these data up to the age of 6 years, comparing breastfed group, the upper line, with intact protein and partial hydrolysate. And you see, according to this study, how close related the partial hydrolysate to the intact protein is for the weight gain evolution. Yet another way to look at those data at the BMI with the different nutritional groups. And of course, this is the Z-score. So the reference for the breastfed group is the 0 line. And you see how there is no difference between the partial hydrolysate, which is the blue line, and the yellow line, which is the cow's milk formula. So really optimal growth with the partial hydrolysate. A study from the US from some 10 years ago, looking at differential growth patterns among healthy infants fed a protein hydrolysate or cow's milk formulas. Again, with the Z line, which is the reference value for the breastfed babies, for weight for length Z scores and weight for age Z scores, where you see in fact that with the partial hydrolysate group, which are the triangles, the values are much closer to the breastfed reference group than with intact protein, where there is a risk for obesity because clearly the line with the intact protein is going up. So to conclude about the nutritional aspects, most of the studies suggest that intact protein, partial hydrolysates, breastfeeding have the same nutritional value, that infants grow on this exactly the same way. And if there is any difference, like in this study, it suggested that the hydrolysate is closer on the nutritional aspects to the breastfed group than the intact protein group. So if there is any difference between intact protein and partial hydrolysates, it's suggesting that the partial hydrolysate offers a better nutrition than the intact protein. A few slides on partial hydrolysate and prevention. You heard a lot about it and you will still hear some new data about it, but of course it's part of the aspects of the partial hydrolysate. These are data from the Gini study, and again, you will hear more about it, but it just shows you that compared to intact protein with partial hydrolysate, you have a reduction of 42% of atopic dermatitis at the age of 15 years. So a prolonged effect of decreased incidence of atopic dermatitis by feeding those infants a partial hydrolysate. Again, Gini study looking at allergic rhinitis, showing a decreased prevalence of allergic rhinitis and a decreased incidence of atopic eczema with the partial hydrolysates. Meta-analysis performed by Alexander and Cabana showing that if you select studies with one typical partial hydrolysate, the same kind of design of studies, the same hydrolysate, you have a preventive effect compared to intact protein when you stop the intervention at the age of 6 months, where the incidence of allergic disease is about 8 to 9% in the control group, 2 to 3% in the partial hydrolysate group. And what is important is that it shows that you keep that benefit up to the age of 3 years, with again a reduction of 50% of all atopic disease manifestations. So short-term and long-term benefit with a partial hydrolysate if it's the same one in the same kind of studies. These data are confirmed by the meta-analysis of Hania Sayeska, published 3 years ago, showing that partial hydrolysate formula compared to cow's milk formula significantly reduces the risk to develop atopic dermatitis. So what I did show you is that partial hydrolysates do offer optimal nutrition, and that partial hydrolysate, at least some of them, are effective in the prevention. What about the cost effectiveness? This is a study looking at the cost all over the world about partial hydrolysate. And what was its conclusion is that partial hydrolysate generally demonstrate dominance over standard formula from the family and societal perspectives and attractive cost effectiveness from the Ministry of Health perspective. And that partial hydrolysate were better than extensive hydrolysate. So partial hydrolysate, although being in some countries being slightly more expensive, are related to reduced cost because of the preventive effect. And this is a study performed in your country in Indonesia, which was published recently, showing that the partial hydrolysate for the first weeks of life in non-exclusively breastfed infant resulted in a reduced cost for healthcare because there was an increased number of days without flare and an increased quality of life years and a net cost reduction because there was also a reduction in atopic dermatitis in those non-exclusively breastfed Indonesian infants living in urban areas. So a positive cost benefit related to the partial hydrolysates. What are the overall expert recommendations? Well, some older recommendations and a new one from the Middle East that I coordinated is recommended uh, partial hydrolysate formula. However, the EACI will, in the new paper, move to the next section and say no recommendation for or against. And that's what most of the scientific associations recommend today. And there are even two scientific associations who recommend against the use of intact, of partial hydrolysate, and they recommend the use of intact protein. But so there has been an evolution from scientific societies for giving the option to the healthcare professional and to the family to use partial hydrolysate or to use intact protein because of the lack of hard evidence of preventive effect of partial hydrolysate. However, I would like to remind you that meta-analysis show that if you select your studies with one partial hydrolysate, good quality studies, you have a preventive effect. And that's only when you pull all hydrolysates together that you lose that preventive effect. So we published with a lot of co-authors just recently a new consensus paper showing that with regards to partial hydrolysates, whilst no harm has been shown, and that's, I think, a crucial message, no harm has been shown with their use. And some studies have suggested potential benefit preventive atopic dermatitis in at-risk infants. There is insufficient evidence for or against a routine recommendation for primary allergy prevention. And the method of hydrolyzation differs for every formula. So you can read this abstract in two ways. At the one side, if you look at all the partial hydrolysates together, there's insufficient evidence to recommend them. But we say at the same time that every hydrolysate differs and that the method of hydrolyzation is very important. And we say at the same time that there are studies that suggested a potential benefit to prevent atopic dermatitis, thus recommended some specific partial hydrolysate. And as you will see, the authors on this paper are, on the one side, key opinion leaders from the European Society of Pediatric Gastroenterology. There are key opinion leaders representing the European Academy of Clinical Immunology and Allergology. And there are also representatives from the World Allergy Organization. So this is a paper with a broad consensus. So guidelines from the last 5 years are a little bit confusing because if you put all hydrolysates together, there is no clear evidence. So with the Middle East colleagues, we published this paper also 1 year ago, of course, recommending exclusive breastfeeding for all infants. If that is possible, that's of course the best way to go. Continue exclusive breastfeeding, and then depending which part of the world, exclusive breastfeeding for 6 months for Indonesia. If there is only partial hydrolysate, continue the breastfeeding and do the allergy risk assessment. If the allergy risk assessment is not done, you give the partial hydrolysate until that has been done. And then if there is a positive history of positive family history of allergy, you use the partial hydrolysate. And important is the bottom recommendation, partial hydrolysate formula, which has been tested, for which there is evidence of benefit. And if there is no positive family history, then we leave the option to the healthcare provider and the family to use either standard cow's milk formula or consider the partial hydrolysate. So not all partial hydrolysate infant formula are the same, and biochemical characterization and functionality is very important. And hydrolyzed formulas as a group category should not be considered uniformly effective in reducing the risk of atopic disease. And there is efficacy of specific infant formula has to be clinically proven, and that's important, clinical studies. So again, another consensus paper from 2 years ago showing that partial hydrolysates are specific, and the results from one hydrolysate cannot be extrapolated to another. And if all studies are grouped together, there is no preventive effect. But if studies are selective on the hydrolysate and the quality of the study, then there is a preventive effect. So all partially hydrolyzed formula are not the same because there is different in the technique how they are hydrolyzed. And so having clinical trials, randomized controlled trials, data from science with scientific evidence are crucial to recommend or not one of those partial hydrolysates. So if partial hydrolysates are safe, if they are nutritionally very good, if at least some of them seem to prevent atopic dermatitis, maybe also allergic rhinitis, if they have a positive cost effectiveness, why not use the partial hydrolysate for everyone? And why would that not be such a wrong idea? Why would that be a good idea? Well, first of all, data from France. If we just look at what our colleagues are doing, we recommend the partial hydrolysate only to 50% of the infants who should get it, because family history is not taken on an adequate way. And so guidelines are not followed, and 50% of the children born with a genetic risk of developing allergic disease because of a positive family history, so they should get the partial hydrolysate. They are not given the partial hydrolysate. Then other data from Germany, we recommend allergy prevention for those infants born in families with a genetic increased risk. However, because the non-atopic families are a larger proportion than the atopic families, and because the risk to develop atopic disease in the non-atopic families is not zero, we recommend, in fact, prevention for only 50% of the infants which will become atopic later. So we use the partial hydrolysate only in 50% of the infants who should get it, and prevention is recommended only in 50% of the infants who will become allergic. And this is a very complicated slide that I will summarize in the next slide, and it comes also from the Gini study. But what does this slide tell us? Well, it tells us that infants born in a family with a negative family history at birth behave the same as at-risk infants if a family member becomes allergic after the birth of the child. In other words, we use as selection criteria the family history of atopic disease, but that seems to be a wrong criterion, because the criterion seems to be genetic background, having genes that put you at risk to develop atopic disease or not, and whether you had developed symptoms or not at the moment that the new baby is born does not matter. It's your genetic background. But we do not know that genetic background at all. And another aspect is that we use intact protein as second choice infant feeding. But the reason for that is uh, mainly just historical. Because if we want something which is close to the composition of mother's milk, there is no of only very, very, very small amounts of intact cow's milk protein in breast milk. And there is almost no intact protein in breast milk, as breast milk also contains proteases to hydrolyze immediately the protein in breast milk. So on the one side, there is no cow's milk protein, and there is even no intact protein in mother's milk. So human milk contains over 1,000 unique peptides derived from a lot of different milk proteins, and they are hydrolyzed within the mammary gland And so they contain bioactive peptides. And so milk proteases actively cleave milk proteins within the mammary gland, initiating the release of functional peptides. Thus, the breastfed infant receives pre-digested proteins and numerous bioactive peptides. So the hydrolyzed protein is closer to the protein content of mother's milk than the intact protein. So let's again go to a consensus paper in which we said that there is no studies which identified potential harm of partial hydrolysate. There was an expert consensus that partial hydrolysate formula is likely as safe as intact cow's milk protein, and that data suggests a preventive effect. And there is one study which was performed in a healthy population of infants in Switzerland, published some 20 years ago. And it was the Zug-Frauenfeld study. So 2 cities in Switzerland. And in one city, there was an intervention with the partial hydrolysate. And in the other city, there was no intervention. And so the endpoint, primary endpoint, was health problems. And you can discuss the scientific validity of this study a lot, but the general outcome is very relevant. Because in exclusively breastfed infants' health problems, there was no difference at all between both groups, 29 versus 31%. In partially breastfed infants, when there is no intervention, there was an increase of 10% of health problems from 30% to 40%. And in non-breastfed infants, there was the same increase from 31% to 39%. However, when you use the partial hydrolysate, there is no difference in the non-exclusively breastfed infants in health problems compared to the exclusively breastfed infants. So it absolutely shows you that partial hydrolysate decreases the incidence of health problems in non-exclusively breastfed infants compared to intact protein. This brings me to the conclusion. Breastfeeding is, of course, the best way to feed all infants, but there is no evidence that breastfeeding protects for atopic and allergic disease, and we should always remember this when we discuss about the evidence for partial hydrolysates to prevent atopic disease. Partial hydrolysates are safe, and both the Food and Drug Administration of the US and the European Food Safety Authority accepted partial hydrolyzed protein as a good protein source for infant nutrition to be put into infant formula to be given to every infant. Consensus paper again, concluding that from a regulatory point of view, partial hydrolysates meet the nutrient requirements to be considered as standard formula for term infants. And based on available data, the use of partially hydrolyzed formula in healthy infants is safe with regard to growth. And there are data showing some benefit. So whey partial hydrolysate formula is nutritionally adequate. There is a lot of evidence for that from the literature. There's also a lot of evidence for the safety, and there is also evidence for a preventive effect that is proven for some of the partial hydrolyzed formula. But also, and you should also remember that there is no evidence at all that there is no prevention. So for overall, if you put all partial hydrolysate together, you may discuss if there is evidence for prevention, but there is certainly no evidence that partial hydrolysate do not prevent at all. And again, as said, for one specific partial hydrolysate, there are multiple studies suggesting some benefit on prevention of atopic disease, such as atopic dermatitis. And with this last slide, I would like to say, Teremikasi, thank you very much for your attention.